Hello parents, I'm Dr. Yatin Bhole. Today I want to talk about something that worries almost every parent, fever in children. The moment the thermometer shows 101 or 102, panic starts. Many parents feel something is going wrong inside the body. But let me tell you something very important from the beginning: fever itself is not a disease. Fever is the body's intelligent defense system doing exactly what it is supposed to do. When a virus or bacteria enters your child's body, the immune system immediately detects that something foreign has arrived. White blood cells start fighting these germs, and during this fight they release special chemical messengers into the blood. These messengers are called pyrogens. You don't have to remember the name, just understand their job. Their job is to send a message to the brain saying, "We are under attack. We need more heat to fight this." These chemical messengers travel through the bloodstream and reach a very small but extremely important part of the brain called the hypothalamus. The hypothalamus works like a thermostat. Just like your air conditioner or room heater has a temperature setting, your brain has one too. Normally, the hypothalamus keeps your child's body temperature around 37 degrees Celsius or 98.6 Fahrenheit. That is the normal set point. When pyrogens reach the hypothalamus, they trigger the release of another chemical called prostaglandin E2. This chemical tells the hypothalamus to increase the temperature setting. In simple words, the brain now decides, let us raise the body temperature because higher heat will make it harder for germs to survive. This is the moment when fever truly starts. The brain has changed the target temperature. Now something interesting happens that confuses many parents. Even though the child's temperature is rising, the child starts feeling cold. The child shivers, asks for a blanket, and feels uncomfortable. Why does this happen? Because the brain has increased the target temperature. So even if the thermometer already shows 100 or 101, the brain feels the body is still below the new target, maybe 102 or 103. So the brain orders the body to produce more heat. It does this by making the muscles shiver, by narrowing blood vessels in the skin, and by making the child want to curl up and conserve heat. This is why during fever, children look pale, shiver, and want warmth even though they are hot. As the body produces heat, the temperature rises and reaches the new set point decided by the brain. This high temperature is not an accident. It is carefully created by the immune system. And this high temperature actually helps your child. Viruses and bacteria do not like heat. Many of them multiply more slowly at higher temperatures. White blood cells also work better when the temperature is a little higher. Antibodies bind to germs more efficiently. So fever turns the body into a hostile environment for the infection. That is why mild to moderate fever is actually helpful. It is like your body turning on a furnace to kill invaders. Many parents worry that fever itself is harmful. But in reality, fever is usually safer than the infection causing it. The body has built-in safety limits. In common viral and bacterial infections, the temperature usually stays below dangerous levels. Brain damage does not happen with ordinary fever. It only happens if the temperature crosses around 41.5 degrees Celsius, which is extremely rare in normal childhood illnesses. Now let us talk about fever medicine, especially paracetamol. Parents often think that paracetamol is treating the disease. But that is not true. Paracetamol does not kill viruses and it does not kill bacteria. What paracetamol does is block the production of prostaglandin E2 in the brain. Remember, this was the chemical that told the hypothalamus to raise the temperature. When you give paracetamol, this signal is blocked. The hypothalamus resets the temperature back toward normal. Now the body suddenly realizes it is too hot. So it starts releasing heat by opening blood vessels, causing sweating, and cooling the body down. That is why after paracetamol, the child starts sweating and feels more comfortable. But the infection is still there. The immune system is still working. The fever will often come back after the medicine wears off. Many parents get scared when fever returns. They think the illness is getting worse. But actually, this is normal. The immune system releases pyrogens in waves as long as the infection is present. So fever rises, comes down with medicine, and rises again until the body wins the battle. This is why doctors do not recommend giving fever medicine just because the thermometer shows a number. We give fever medicine when the child is uncomfortable, in pain, not drinking, or unable to rest. We are treating the child, not the thermometer. Now let me address one big fear. Many parents think that fever can cause seizures or brain damage. Fever itself does not cause brain damage. Some children between 6 months and 5 years can have something called febrile seizures. These are triggered by a sudden rise in temperature, not by how high the temperature is. These seizures look scary, but they do not cause brain injury and they do not mean epilepsy. They happen because the immature brain reacts to temperature change. Most children outgrow them. What matters much more than the fever number is how your child looks and behaves. Is your child playing a little between fever episodes? Is your child drinking fluids? Is the breathing comfortable? Is the child responding to you? These things are far more important than whether the thermometer says 101 or 102. So the next time your child has fever, remember what is happening inside. The immune system has detected an infection. It has sent chemical messages to the brain. The brain has raised the temperature to help fight the germs. The shivering and chills are just the body trying to reach that new temperature. Fever medicine simply resets the thermostat to make your child comfortable. And the fever will go away when the immune system has done its job. Fever is not something to be feared. It is a sign that your child's body is strong and actively protecting itself. Thank you for listening. If you found this explanation helpful, please like and subscribe so that more parents can understand fever without fear.